Today we're going to be talking about infants and toddlers and why chiropractic is so important for them, just like it is for you and I. Now, a lot of patients out there who have kids may not even know that their young ones should be going to a chiropractor. Some might even just be a little nervous about the idea because they see how we may be adjusting you or your spouse, and it may just be a little scary. And so the purpose of today is to answer some questions you might have, kind of remove those barriers, because believe it or not, it is very important that they get checked by chiropractors regularly, just like you and I, for a very simple reason, and that just like you and me, they have a spinal cord and a nervous system. And their nervous system controls everything that their bodies are supposed to do. For their heart to beat, their lungs to breathe, for bumps and bruises that they're going to get to heal, they need that proper nerve flow from the brain, down the spinal cord, out through those nerves, and then back up. Any subluxations, any impedance on that is going to affect their health and their development just like it would for you or I. Now, there are some key differences between their spines and ours, particularly when we're talking about our newborns and our toddlers. Now, a normal spine for adults, proper structure dictates we want a spine that is straight from the front and has 3 curves from the side, one in the neck, one in the upper back, and one in the lower back. Now, our little ones, other than just being smaller and more delicate, don't start off this way. In fact, when we are born, we all start off with one curve, like this. This is more commonly known as the fetal position. It's a singular arc that allows for force to be dissipated within the womb. However, once our children are born, and they start to look up to see the world, that first curve in the neck is formed. As they then transition to crawling and then to standing, they get that third curve, in the lower back. From then on out, for all intents and purposes, their structure should be the same as ours, just on a much smaller scale. And therefore their nerves and their spinal cord should be going through in this way unimpeded. So any subluxations that occur along the pathway during development is going to impede their ability to develop those curves. So this is very, very important that we catch these things early, particularly when it comes to difficult birthing processes. For example, my son Lincoln, when he was born, he had such a hard time coming out, and they had to pull so hard to get him out. They ended up fracturing his arm clean in two, right through the right arm. It took me weeks of adjusting him every single day just to get his neck back in order because of all the twisting and pulling it took. While this is an extreme example, it doesn't take all that much force to have just a single subluxation happening, particularly in that head and neck area, that might impede their ability to get those proper curves down the line. What that'll eventually lead to is permanent situations where we may not be able to correct these things. Now, we do have some time on that end, but the sooner we can get to those subluxations and allow for their nervous system to process the health that they're going to develop in the future. Beyond the birthing process, the next question is, well, why would my child be subluxated in the first place? And the really simple answer is, they fall. A lot. They're going to fall when they learn to stand, when they learn to crawl, learn to walk, run. They're going to fall just running around not looking where they're going. Not every fall is going to lead to a subluxation, but the ones that do need to be addressed. Now, the way a subluxation happens in the first place, to kind of pull back for you, remember a subluxation is a misalignment of the spine where it gets stuck out of position and it puts pressure on the spinal nerves. That pressure on the spinal nerves is what affects function, what affects health. Now, in order for this to happen, the spine has to experience some force that it cannot tolerate or resist. Now, when the spine is in the proper orientation, about straight from the front, 3 curves from the side, it is able to dissipate force fairly well. That's the purpose of those 3 curves. But every once in a while, we experience a force that is greater than what we can resist. And at that point, we are subluxated. Our children are no exception. What are the benefits to checking these kids for subluxation, making sure that they are free from it? Well, the first, and the one we allude to the most, is overall development. That's the development of their curves, of their nervous system, and all the organs and muscular systems those nerves go to, which I'm here to tell you is everything. That's their cardiovascular system, heart and lungs. That's their endocrine system, all their hormones, digestive system. All of these systems require proper nerve flow in order for them to develop properly. And so checking for subluxation regularly and removing those that we see allows them to develop at their optimum rate that they're supposed to. Additionally, chiropractic care has been shown to boost immune function, particularly white blood cell count, by 300% post-adjustment. Multiple studies have shown this, and it holds up over time. And so for you and I, getting adjusted when we're sick is very important because it helps us get better faster. For our children, it's even more important because their immune systems are still developing. They don't start off with this robust immune response like we have. They have to develop it over time as they meet new bacteria and new viruses. And so helping to maximize their immune response is going to help them get over sickness faster and not have as severe reactions to those illnesses. Similarly, allergies work on the same concept. Histamine response is how allergies are regulated. And when chiropractic care is used properly, histamine response can be boosted to its maximum degree, which will hopefully minimize our children's reactions to common allergens or severe reactions over time as they come across these things. And one thing very specific that we see with our little ones in chiropractic care is how they respond to ear infections. Now, I do want to be very clear, we do not treat ear infections directly. In fact, we don't treat any condition directly except subluxation. But by helping the body to function at its best, we are able to see awesome changes occur in these types of conditions. So why are ear infections so prevalent in young ones? First of all, what I alluded to before, a weakened immune system that is not as developed to fight bacteria and viruses that might get trapped in the ear canal. And second, their ear canals are much smaller and more slanted than ours, which allows for those bacteria and viruses to get trapped there in the first place. So, chiropractic care can help to boost that immune function, help them to fight anything that is trapped, and light, gentle manipulation of the ear canal and the earlobe can help to open things up and allow the body to flush out those bacteria much, much easier and quicker. And so, children who are under chiropractic care tend to have a far fewer instance of ear infections and tubes being put in the ears, and they tend to overcome those much faster. Again, not treating directly, but helping the body to maximize what it is capable of doing, which is healing itself. So, the next step, which really comes down to the nervousness for most parents, is how, in fact, we would actually adjust their children. Because like I said before, you may see how you've been adjusted or how your spouse is adjusted, and sometimes it's aggressive because we're stubborn, we're old, we don't move very well. Our children, on the other hand, don't have the negative of time and stress to work against them. They are very, very easy to adjust without having to put a lot of force into them. And the way we're going to adjust is very different for every child, depending on their stage of development and their comfort levels. For most infants, newborns, those who aren't quite yet rolling around too much and will lay still on their back, we simply lay them on the table, potentially on a blanket or a cushion if mom or dad requires that or prefers that for safety or for comfort. And we'll use light pulsations with the fingertips, like so, on the subluxated areas to get them to move. It really doesn't take a whole lot. As they get a little older, as they might become more mommy-daddy dependent or possibly have fears of going to doctors because of experiences with pediatricians or with getting shots, in those cases, we have to take that into account. We don't want to force anything or make it a bad experience for them. So what we'll oftentimes do is have them either stand on the table facing mom or dad, or in severe cases, have mom or dad lay on their back and lay their toddler on their stomach so that we can have access to their spine. In those cases, we will take an impulse device like this, do light taps in the areas that need to be adjusted, and it works just fine. As they graduate and get a little older and become more comfortable again, we'll transition them to adjustments that more closely approximate what we do with our adult patients. Nowhere near as much force, because again, that's not needed, but it starts to look more similar in the process. All right, so these are my buddies, Everett and Roland. They've been getting adjusted since they were 1 week old apiece, and we're gonna show you kind of what we do at their various stages. So Everett here is still in that stage where he generally will lay down nice and easy on his back, and we just feel through to see if anything is subluxated. And if we find one, all we do is just a light pulse with the fingertips, and it tends to just glide right in. So let's see if we find anything. Yeah, buddy. You're doing so good. And you have one right here, so just a little push. There we go. So you barely see a thing. Now we come down into the hips. See, and we're a little off on that left leg. So what we're going to do is just a little push. Good. And that is it. Very simple at this age. It doesn't take much at all as long as we're looking for the right things and doing the right angle and range of motion that we need to. Now with Roland, he is a big boy, right, Roland? So we do big boy adjustments. So with the neck, it's pretty similar. Now he does have one right here, so really all we do, just a little push like that. Very good. Then we come and we cross our arms, and we can probably give him a big hug, but I always tell him he's not allowed to laugh. You're not allowed to laugh, Roland. Don't you laugh. Don't you do it. There we go. Good job, buddy. And then we just keep moving down and checking the other areas. Just like with Everett, just feeling through, making sure everything's lining up and moving right. Check the legs, and a little bit on this hip here. So similar, 1, 2, 3. There we go. And that's it. Can I get a high five? Yeah. So the next question is, when is the right time to have your kids checked? And the answer is today, yesterday even, as soon as possible. Every child that is born is capable of being checked right away. We have patients who have brought their children home from the hospital that same day and come here that same day to have them checked. Doesn't mean they always need to be adjusted, but the point is ruling those things out immediately. Outside of severe cases, like children who might be dealing with scoliosis or torticollis, where we have actually conditions we're trying to treat, most kids only need to be checked about once a month. Sometimes they don't even need to be adjusted, in which case that visit, if you will, is complimentary. There's no charge to just check your child outside the initial examination where we're actually looking to see what the baseline is. From there, it's just monthly checkups to make sure things are going the right way. And of course, if your child is hurting or they fall, we want to bring them in to get them checked because that's an actual injury that could potentially lead to subluxation. But a very key point here is I don't want you to wait solely for that ache or that pain, for that complaint, for the injury. Obviously bring them in if that's happening, but remember, only 10% of your nerves control pain. So you can have a subluxation compressing 90% of their nerve and they're not complaining of anything and you're not seeing the changes right away. But maybe their heart's not working right or a muscle's not working right and their gait's starting to come off and now they're walking funny. That could happen weeks or months down the line from the initial subluxation. So if we just wait for that symptom, we've already missed the boat on taking care of this right away. So remember, don't wait for pain for your children, don't wait for injuries. But if it happens, please bring them in so we can check them and set them on the right path. That we can prevent a host of things down the line. So to kind of wrap it all up, guys, I want to make sure that you and your families are living your best lives and being as healthy as you possibly can. And that starts with the 6 essentials. That's 15 minutes of prayer, meditation every day to help lower stress levels. That's getting your regular spinal reengineering adjustments, practicing good posture habits, doing your traction exercises at home. That's eating 75% off the vine or as close as you can to that and trying to eliminate those excess chemicals and artificial processed foods from your diet. It's getting regular exercise, whether that's high intensity interval training, regular cardio, weightlifting, going for a walk, swimming. Moving with intention regularly just goes a long way to making sure your body is healthy and moving. We want to make sure we're getting good quality sleep, sleeping on your back with your rolls and wedges if they're prescribed for you, staying in a good rhythm with when you're going to bed and when you're waking up so your circadian rhythm is not interrupted and you're getting good quality restorative sleep. And then finally, detoxing twice a year to remove all the things you couldn't avoid, those toxins, those chemicals and additives that we can't just completely avoid unless we live in a bubble. That's why detox is so important. If we can follow through as best as we can with those 6 essentials and minimize the additive stresses that are avoidable, you can live your best optimal life, as can your family. As always, guys, patients, your loved ones, friends, anyone you know who you want to get them checked out, they can do so for $47. That's a new patient exam, x-rays, first adjustment, and doctor support to go over our findings and any recommendations, all covered for $47. But if you can get any of these loved ones or friends to watch any of our workshops, this one included, and they bring in that sheet showing them they watched it, that is a complimentary examination for them that covers everything the $47 would have. So basically they learn something new that can help them and their families, and they get a free exam and adjustment out of it. It's a no-brainer. And so I want to thank you so much for joining us, for listening today. Hopefully we answered some questions, calmed some fears or nerves that you might have had. And as always, I want you to stay healthy. We look forward to seeing you and your kids in the office soon.